Hi everybody, welcome back to CBT with you and me. This is Maddie Birchfield and today we're going to be looking at the Positive Psychology Toolkit and their exercise, Reframing Critical Self-Talk. To know when to use reframing critical self-talk, you have to know if there's self-criticism existing within the client. Now, self-criticism is the opposite of self-compassion, and this is when the client directs negative and punishing thoughts at their own personal characteristics. So how do you know what self-criticism looks like, and how do you know if it's something that you should work on with a client? There's 4 examples that this toolkit looks at when thinking about self-criticism. The first one is threatening. Does the client create negative consequences for their unmet goals? Or say things like, if you don't work more hours, you'll be let go, to themselves. 2, are they monitoring weaknesses and mistakes, keeping track of repeated mess-ups and cycles of failure? Does the client say things like, you screwed it up like always? The third example is commanding. Does the client demand the behavior causing criticism is changed? Saying things like, you need to stop acting like a nerd, without offering real solutions. And then 4, do they use a judging tone, assigning negative value to attributes of oneself? Saying things like, your feet look huge in these shoes. Here's an example of a judging tone in the popular TV show, The Good Place. The Positive Psychology Toolkit says that obviously self-criticism can be quite distressing and often results in negative emotions like fear, shame, and guilt. Additionally, self-criticism can grow into these forms of psychopathology, such as eating disorders, substance abuse, depression, and social anxiety. So if you address and assess that your client could benefit from this exercise of reframing critical self-talk, your goal is to help awaken the client's self-awareness to inner critic and foster an opposing, self-compassionate narrative. Essentially, introduce a nicer and more kind internal voice. One of the first things to do when introducing this exercise is help client compare how they speak to themselves versus how they would speak differently to a loved one. One of the examples that I use is help them realize they're just being mean and help them see that they should talk to themselves like Leslie Knope talks to Ann Perkins. In step 1, you increase the awareness of the self-criticism. Request the client try to monitor inner thoughts that are self-critical. Then give them coping mechanisms to combat the negative thoughts in the moment, like breathing techniques, things to calm down. After this, ask them to keep track of tone and repetition of phrases tied to behaviors, seeing patterns that they can address. Advice for step 1, put a name to the self-critical voices, and you can create distance between the person and the thoughts. Some examples are inner critic and inner bully. In step 2, take action, soften the critical voice. In this step, we're rephrasing the criticism in words you would say to a loved one, practicing using the same understanding tone with yourself, and analyzing the things that cause your inner critic to come out and see how you can change the feedback. Advice for this step is pair the reaffirming phrase with a physical gesture. Tell the client to rub their arm, give themselves a massage, or stroke their hair when they're trying to reframe their ideas. Also, don't let the client fight the inner critic. Negative responses only further frustrate the client. Additionally, preemptively locate their triggers. Words, gestures, and physical reminders help the client in this awareness exercise when they already know things to out for and remember to address. Thanks for listening. If you have any questions, shoot me an email at madelinebirchfield@uiowa.edu.